Dr. Ara Deuk, CEO and founder of the Deuk Spine Institute, Deuk Joint Institute. I'm here with one of my patients who's traveled from Ohio to the Deuk Spine Institute.
By automobile.
By automobile with his lovely wife. He came here after suffering for many years with back and leg pain, neurogenic claudication from stenosis. And you had been treated in other places up in Ohio for years and still suffering. And then you came to the Deuk Spine, you had your surgery yesterday, and how do you feel today?
I feel good. I feel good. I can stand comfortably without any pain. And I was just out walking earlier and had no issues whatsoever.
What kind of problems did you have before the Deuk laser disc repair?
Primarily, I got severe cramps in my upper legs, both legs, when I was standing. I used to do cooking. I'd buy these home chef meals that they'd send you all the ingredients and the recipe, and then you cook it. And while I'm cooking, I started getting these things, and I just had to stop and find a place to lean on to relieve something. And then after a while, it would get improved enough so that I could continue, but I couldn't see doing that for months in the future. So I stopped that program. That's when I realized that I really needed to do something, take some action.
Yeah, you were suffering and it was getting worse. And you had neurogenic claudication. That's
Right.
what we call that in the
Right.
medical field. You also had back pain, and you had treated for years somewhere else, right? And
Right.
did those treatments help you?
No.
Tell us about that.
Well, initially I started having back pain in my lower back, and I attributed it to primarily when I was standing. We'd go to these flea markets and so on, and there's a lot of standing there when you go with a spouse or whatever. And anyway, I
understand.
I started having low back pain, and I started to explore that. The only way I could relieve it was to just bend over and stop for a while. I came to believe that it was caused by a fallen arch. So I got some arch supports and some different shoes and so on, and I seemed to get some little relief, but it never really went away. That was probably a good 20 years ago. And since then, it's just gotten worse and worse and worse and worse until yesterday.
And you've had shots in the past and pain management procedures?
I did not.
Oh, you did not? So
No.
what did you do to treat it for all those years?
I took a lot of naproxen and ibuprofen. And,
Anti-inflammatories.
Yeah, I took those to the point where I went and got an esophageal exam. They said, you better not take that stuff anymore.
You were getting an ulcer,
Yeah.
probably.
I had a hiatal hernia, and between that and all these NSAIDs, I was having a lot of acid reflux, and that was causing a whole different
Problems for you.
problems. Yeah.
So why did you decide to come to the Deuk Spine Institute?
I said to myself, there must be a way that solves this problem once and for all. And I started looking diligently online, because that's how you do it these days. And I found the Deuk Spine live back surgeries, and I started watching those. And along with those videos, there's a lot of education that goes on. I just came to believe that based on everything I'd already experienced and what I was seeing on the YouTube channel, that had to be the best and only way. And I couldn't imagine why the only place it was available was in Florida, but you get what you get.
All good ideas start somewhere.
Yeah, right.
And then they have to spread.
Right.
All right. Well, thank you for sharing your story. And is there anything else you want to tell your folks out there watching your testimonial?
I think when you start looking for a solution, you're going to come to a spine surgeon or a neurosurgeon, and he's going to look at your pictures and he's going to say, you need a laminectomy. When I heard that, I realized that my surgery was ending on that path, because I did not want a laminectomy. I didn't want any bone removed. I didn't want any big scars. I didn't want anything implanted in me. So that led me to a different kind of search, which led me to Deuk Spine.
That's right. And we did your surgery yesterday without any laminectomy. We did it through little cuts that big, 7 millimeters.
Right.
And how are you feeling today?
My problem is cured.
Congratulations.
Thank you.
Safe travels back to Ohio.
Thank you.
You're welcome.